Thank you and welcome to my YouTube channel. And if you have subscribed, a big thank you to you. If you haven't, hopefully you'll be considering doing that today and possibly share. I'll be discussing or starting a series on a very important topic that I strongly believe you're going to learn from, at the same time be willing to share with others. It's rheumatoid arthritis. It's a topic that's generated quite some interest. Hopefully I'll be able to break it down. There are certain words that may still prove to be challenging. Perhaps you could skip those areas for the medical doctors or those in the medical profession. However, I'll do my best to explain as detailed or as best as possible, so to say. Right, so let's jump right into it. What is rheumatoid arthritis? Rheumatoid arthritis is a chronic inflammatory autoimmune disorder. Now, I'm going to break that down because that's packed. Chronic in the sense that it's more than 6 weeks in duration. In other words, the symptoms have been on for more than 6 weeks. Inflammatory in the sense that there is pain, swelling, and for those that are light complexion, you will see the redness. Now, in addition to that, I need to make a distinction between two types of pain. Inflammatory type pain that occurs in rheumatoid arthritis and mechanical kind of pain that occurs in osteoarthritis. Now, for patients that have rheumatoid arthritis, we say the pain is inflammatory because on waking in the morning after a period of rest, the pain tends to be worse, or after a period of inactivity. However, for osteoarthritis, the pain tends to be worse during motion, during movement, or in the course of activity. It's important for us to keep those two distinct types of pain in our minds. Now, another aspect of inflammation that I need to explain to us is that one of the key components of inflammatory pain is swelling. Now, a way to illustrate this is if a building was on fire, the fire brigade will be called in. Now, on arrival, they will pour an enormous amount of water depending on the amount of fire. Now, if someone came afterwards, what the person will see will be water and not fire. The same way we could use that explanation to say that if there is an inflammation in the body, a lot of blood will be moved in that direction. At the end of the day, there's much more blood in that environment than there should have been at the beginning, and so that partly explains why swelling occurs. Now, the other aspect, when we say rheumatoid arthritis, is a chronic inflammatory autoimmune disorder. An autoimmune disorder simply means destruction of self or fighting itself, or the body fighting itself. Now, an easy way to explain this would be when you see siblings growing up as children, they tend to have squabbles from time to time. But as they grow up, they will gradually understand each other, tolerate each other to the point where they are less likely to fight each other. So also imagine the number of cells in the body. They've grown, they've been together for such a long time, such that they tolerate each other. They don't fight each other, so to speak. However, if for any reason there is an alteration in any of these cells, the other cells will read them as foreign and begin to attack them. I'll give you an example. The soldiers of any country are trained to annihilate foreign invaders, and ordinarily they would not kill the civilians in their country. However, if for any reason these civilians in their countries take up arms against the state, they will be seen as insurrectionists and therefore dealt with. Now, the simple reason is this. The white cells of the body act as the soldiers of the body, and so they ward off foreign invaders. Now, the cells that stay in the body are alike. They know each other, so to speak. If for any reason there's an alteration in those other cells, the white blood cells will read them as foreign invaders and begin to attack them. Now, that explains in a very simplified way autoimmune disease, why cells of the body fight one another. Now, this brings to the fore that rheumatoid arthritis is not just arthritis. Now, when people use statements like that, the thinking is that because they think that arthritis is just a joint problem, they feel that, after all, why are you making so much a big deal out of just a joint problem? And that's a big mistake, because rheumatoid arthritis, though called rheumatoid arthritis, is not just a joint problem, it's actually a multi-systemic disease. In other words, organs of the body can actually be affected by rheumatoid arthritis. I'll give you an example. The liver can be affected. The kidneys can be affected. The eyes can be affected. The skin can be affected. Nerves can be affected. Surprising, isn't it? Absolutely. Therefore, we need to appreciate the fact that rheumatoid arthritis is not just simply an arthritic problem, it's actually a multi-systemic disease. To the point where, if not properly managed, it can actually shorten lifespan by as much as 5 to 9 years. Now, when a patient develops these symptoms, it's important that this patient is seen by a specialist as quickly as possible, because there's what is referred to as the window period, which is a very short period within the first 2 years of onset of disease, because if you don't treat aggressively early enough, it can lead to marked functional limitation or damage of the joints. And so you have a situation where patients that develop rheumatoid arthritis may actually become wheelchair bound if they are not properly managed, or actually lose their jobs simply because the joints of their fingers have been damaged. So we're dealing with a condition that has very, very dire consequences if not properly managed. Thank you very much. Hopefully you will continue with other videos concerning rheumatoid arthritis series.